Anuj Agarwal is a radiologist in a prominent hospital in Delhi. He's currently in isolation after being infected with COVID for the second time.
Physically, we are very much exhausted and burdened, and at the same time, mentally, we are facing so much of pressure and turmoil as well as anxiety.
While Omicron might be causing fewer deaths compared to the Delta dominant second wave, it's still taking a toll on India's overburdened healthcare system. Sometimes seen as gods in white coats, saving lives, doctors, nurses, and medical staff across the country are testing positive in large numbers. Recent health ministry guidelines, though, have done away with quarantine periods for asymptomatic doctors as well as contact tracing for those testing positive, both of which adds to the stress for doctors like Agarwal.
Earlier, there used to be a isolation period to those doctors, but now that period has been removed. So this thing is also a negative thing because now the doctors might be asymptomatic after their duties in the COVID ward, but they can still transmit the infection to their co-workers.
Last year, doctors across India were out protesting in the streets, demanding that the stalled process of inducting some 44,000 junior resident doctors into India's healthcare system be initiated soon. The process is only now starting as the third wave triggered by Omicron has already begun to peak. Shivranka Datta, a junior resident doctor at the premier All India Institute of Medical Sciences, has just resumed his duties after recovering from COVID.
For almost more than 1 year, there has not been recruitment of the first year junior residents, and the healthcare system relies a lot on the junior residents because the most of the regular ward works and OPDs are run by the junior residents in the country.
Lack of medical personnel is among the biggest crises facing India's healthcare system, says Akshay Yadav, a resident doctor in Mumbai.
Before the pandemic, also resident doctors used to work for, for 72 long hours. But in that, we used to get a gap or a break where we can relax ourselves so that our immunity is not hampered to a level where our health is compromised. But yes, in this pandemic, and already when we are at 66% of working capacity, our immunity is definitely compromised and our health is getting affected more.
At least 2,000 doctors have lost their lives since the pandemic. The Indian Medical Association, though, says very few families have been monetarily compensated. Many healthcare workers are questioning the delay in rolling out COVID vaccines and booster shots in India. But with early data showing much lower mortality rates from Omicron compared to Delta, the hope for now is that the third wave will wane soon and give some respite to the exhausted gods in white. Smita Sharma, TRT World, New Delhi.